What you don't have in normal surgery is that you don't have the time to play around with the anatomy of the aneurysm and to approach it from different angles or to take your time. So this was the first time I've done a simulation like that and never had the opportunity to do similar simulations before. Not in real life with a model that you can touch and play with around. I was quite surprised by utility. So in the beginning quite skeptic, but then after using it for a couple of minutes, it became clear to me that there is quite some advantages to be using the model like that. What's really good is the perfusion. So you can really see and feel the aneurysm pulsating and being perfused. And to manipulate the aneurysm in the brain as you want without the risks involved in surgery. Orientate the head really in the position that you're used to. What's really cool afterwards, as soon as you install everything, you have the same sitting position, the same microscope, and the same position of the hands that you use during surgery. So everything is getting very close to the orientation that you would have during the real-time surgery. So in the normal radiology images, you have predefined planes, 3 planes in the normal images. Then you can reconstruct it in 3D, kind of move it in the direction that you would like to look at. But then everything else is missing. So you're not using your hands. You're not using the haptic feedback, you're not really using the little constraints that you have in terms of angle and vision that you can use here. So the model really shows you a situation that comes very close to the real life. The software is pretty intuitive. We can also use the PAC system that we have in the hospital. The experience that you get from the haptics and the vision is the value that you personally get from it is not something that the other surgeon in another hospital would profit, because it's a situation that's customly tailored to every patient. So this is why I think the value is generated during you, the model, and the patient. As with everything else, there is a learning curve. The most beneficial part is planning surgeries, teaching also young neurosurgeons, and then with the experience in mind, discussing things with colleagues. But I think that I would put the training and the pre-operative planning. Yeah, just bring it into the world and let us use it. Complicated, even not complicated cases, if it's doable, it'd be very good to have a model beforehand. And then you can just play around with the clips, try different tactics and approaches, position of clips and stuff like that. So it'd be very nice to have that before. The point is, and this is really one of the wishes that I would like to see in this world in the future,